our health correspondent, Nicola Hill. Nicola, this is all because of the Delta variant, right?
Yeah, completely, Adnan. I was speaking to Professor Paul Hunter this morning. He's Professor of Medicine, University of East Anglia, and one of the advisors to the WHO. And we know the Delta variant is up to 60% more transmissible, particularly among young people. And of course, it's a lot of young people who are mad football fans. They're the ones who are travelling around. And he said, certainly in the UK at the moment, the Delta variant is responsible for 98.5% of cases. Now, here in the UK, we've had a very successful vaccination programme. Professor Hunter says like 95% of people who are very vulnerable to SARS-CoV-2, the virus causing COVID-19, have either been vaccinated or have had an infection and they're protected. So although we've got massive increase in numbers of cases being reported, a fourfold increase in the past 3 weeks because of this Delta variant, we haven't got the same hospitalisations and deaths. But that's not the case in many European countries who haven't got the vaccination, the 2 jabs that are necessary to protect against this Delta variant. And that's why it's worrying. That's why many countries have closed their borders. But actually, Professor Hunter says to me, it's too late. You were saying earlier that they're reckoning by the end of August, it'll have spread across the whole of Europe. Professor Hunter this morning said to me, he thinks it might even be by the end of July, the beginning of August. So basically, that variant's there and it's spreading quickly.
Yeah, absolutely. It was about a week ago or so. I turned the TV on, wanted to watch Italy's game at Euro 2020. They showed a shot of Piazza del Popolo, one of the main squares in Rome. And there must have been at least 250, 300 people there, almost nobody wearing masks. They saw the camera was on them. They started cheering and shouting. And I'm thinking, what's going to happen in 2 or 3 or 4 weeks? How many more infections are we going to see? Do you think, Nicola, the authorities are going to look back at this summer as it is in Europe and think we made a mistake, we shouldn't have let this tournament happen?
Well, this is something that I actually put to Professor Hunter. I said, do you think we should have let the Euros go ahead? And his words to me were, you may say that, I couldn't possibly comment, which is a reference to how politicians often leak their views. So basically, yes. And as he pointed out, and as you've just illustrated there, it's not necessarily the matches themselves when you've got the fans sitting outside. It's the celebrating. It's the build-up beforehand, the celebrating afterwards. It's that hugging and kissing. Even if it is outside in a square, you've got people shouting, they're singing, they're not wearing the mask, they're not doing social distancing, and they're spreading the virus. And if it is the young people who've got the Delta virus, they may show no symptoms whatsoever. They may feel perfectly healthy, but they're spreading that virus around very rapidly. We've had Public Health Scotland actually say that following the Scotland-England match here on the 18th of June, there were nearly 1,300 cases that were linked to fans who travelled to London and nearly 400 cases of people who'd been to Wembley. So it is that celebrating, and it's, as you said, Adnan, 11 cities in 11 countries. That's widespread. That really is a lot of travel, public transport, planes, whatever, spreading the virus.
That's right. Hundreds of cases of foreign fans who'd also been in the Russian city of St. Petersburg to watch their teams play over there. Nicola, thank you very much indeed. Have a very good weekend. Nicola Hill, our health correspondent.